All right, welcome, Mallory. Thanks for coming on here for our spotlight series of the best in Utah in public health. I'm excited to dive in on who you are and what you're about and ask all these fun questions.
Thanks for having me. I'm
Yeah,
excited too.
yeah. So I'm just going to read your bio here so the audience knows who you are. Mallory is a licensed acupuncturist by the state of Utah and certified diplomat of the Chinese medicine through NCCAOM. Is that how you say it? Okay.
Yeah, like the main national accreditation.
Okay, great. With a clinical specialty in conditions related to pregnancy, fertility, and women's health, she is also a member of the acupuncture and the TCM Board of Reproductive Medicine, focusing on the integrative treatment of infertility. She currently practices at Flow Acupuncture, an award-winning wellness clinic dedicated to providing quality healthcare and community resources. Combining acupuncture, traditional Chinese herb medicine, and nutrition in her practice, she is deeply passionate about each patient's unique health journey and strives to create a space in which individuals can discover their own potential for healing. Chinese medicine has shaped her view of health, and she is grateful to have such valuable tools to guide her through many of life's phases, including becoming pregnant and giving birth to her son in 2023. Outside of her practice, she enjoys cooking, traveling, and spending time outdoors with her family. Well, thank you so much, Mallory, for coming on. I'm excited to jump into these questions. And so right off the bat, like, what made you decide to be an acupuncturist?
Yeah, so I actually got into it through when I was in college, and I started getting acupuncture myself and just noticed a lot of things changing, my health improving in a lot of different ways. And I have a dance and movement background, and was also at the time taking a lot of classes and things like yoga, kind of these more somatic and meditative practices as well. So I kind of got into some of the philosophy behind Chinese medicine at that same time. And when I graduated from college, I was just kind of piecing things together. I knew that either healthcare or helping people was like in my future at some point. My mom was a PA for like over 30 years. So at one point I thought about going into like more Western medicine and going that route. But ultimately it was, yeah, just the benefits that I had had from Chinese medicine and acupuncture myself that made me want to like pursue it further. So I just started studying it. I jumped into school right after I graduated from college and just kind of hit the ground running and never looked back. I just loved it. So
That's amazing, amazing. Okay, what would you say that makes you different amongst your peers?
yeah, so I mean, I think part of it in terms of just my training and specialties, I think especially here in the Valley kind of set me apart. The um, the reproductive medicine, I think I'm only one of two that in the state kind of has that more specialized training. And I think, going through it myself now, the process of becoming pregnant, having a kid, going through postpartum very recently, I think has definitely colored and shaped like just my approach and just how I treat and see individuals going through that. It's definitely like given me a lot of um, just a deeper kind of understanding of what a lot of our patients are going through. Um, so yeah, I think that's one thing that kind of makes me different. But yeah.
Awesome. And then who would be an ideal fit for you? Like what kind of patient client that are you looking for that's like, oh, this is my bread and butter?
Yeah, I kind of found myself in this specialty through just treating pregnancy. I've had a lot of different clinical experience at this point, and when I started, I was actually working in a community clinic, and that's kind of how I initially became introduced to treating pregnant women. My boss, his partner was actually a midwife, and so we got a lot of referrals, and that's kind of how I started treating that. And I think, maybe this answers some of your previous question too, but not a lot of acupuncturists really want to touch pregnancy.
That's
And
wild to me.
yeah, yeah. And, we were one of the few places, I think that were like willing and able and just wanting to treat that. And once I did start treating pregnant women and pregnant people, I just was like, these are the best patients. So, I think it's something that can be really helpful. And for whatever reason, people respond really well to acupuncture while pregnant. So not only is it, just safe, but it's just great to like maintain a healthy pregnancy, alleviate all the aches and pains. And so I think my ideal like person is someone who's, you know, going through the whole process. And I love just treating before, during, and after pregnancy. I just love seeing people through that whole process. It's such a rewarding thing. But yeah,
Amazing. Amazing.
pregnancy is my jam.
Yes. Yeah, amazing. Same. Okay. What does the process look like to work with you? Like, how does someone come to work with you?
Yeah, so I work at a clinic called Flow Acupuncture, and we have a few different acupuncturists. But basically, someone will come in for an initial appointment, and we go through quite a thorough health history. And I ask, you know, a decent amount of questions just about where they're at. Oh, God, I'm sorry, cats jumping. Just like where they're at, whether they're trying to conceive, where they're at in that process, or if they're already pregnant. Just we talk about just different things that they're wanting to focus on, different health concerns, as well as their health history. And then I provide acupuncture, and if they haven't had acupuncture before, I usually walk them through that whole process, make sure they're really comfortable. Will administer acupuncture needles on various points to kind of help address those concerns that they're having. And then the acupuncture itself is usually about a 30 to 40-minute procedure or process. And so we let people just rest on the table with the needles in, and most people kind of just conk out, space out, take a little nap. It's really just restorative too. And then from there, we kind of talk about a treatment plan. Most things I'm going to be seeing people pretty regularly to start. It's just the way acupuncture works. So our initial treatment plan can be anywhere from come see me a couple times until we get this specific condition, like or alleviated. Or if it's something like just kind of overall health and wellness throughout pregnancy, I'll often see people once a month, a couple times a month, something like that. But if we're working on something specific, I'll usually see them weekly for anywhere from, you know, a couple weeks to a couple months, just depending on what we're really trying to focus on. So
awesome. Awesome. Thank you for that snapshot. Okay. In the grand scheme of things with pregnancy and postpartum, what does recovery look like in your profession and your ethos of care?
yeah, so, you know, the way we look at, you know, pregnancy, birth, and especially like kind of old school traditional Chinese medicine, like that recovery, like a lot of women during that time were just able to rest, and they had mothers and grandmothers, all these people bringing them like nourishing soups and really like calorie dense foods. And the main focus was, you know, just rest, feed your baby. You don't have to worry about anything else other than recovery. So in our day and age, it looks a lot different, but you know, the healing in that initial like rest when you can get it is so important. And we try to help kind of prepare the body before that even happens. So we, you know, that's huge when I'm seeing someone during pregnancy, is we're always thinking about recovery, even, you know, before we get to that place. So going through birth is such a big event and is very taxing on the body. And so once someone's gone through that, we really want to focus on nourishing what we call their like kind of their deep reserves, their deep energetic reserves. We call that qi and blood in Chinese medicine. So that is encompassing of, you know, foods that they can be eating. Sometimes I'll send people home with herbs or just like a bone broth, a couple of herbs they can add to bone broth at home beforehand so that they're like, that's ready to go. And then obviously acupuncture, some different techniques I'll do at the clinic just to help more with like actual tissue healing and repair. There's a process called moxibustion, which sometimes we'll do during pregnancy, but it can be really helpful for that recovery process too. So, and traditionally that was like 40 days that women would just sit and rest. That's kind of the So about a month or a little bit longer. But that's usually when I'll kind of start to see people is in that first month, if we can, for just general recovery. Yeah.
Awesome. Awesome. Okay. What's something that most people don't know that you think that they should know, whether that's about acupuncture yourself, your practice, pregnancy, postpartum, like any little nugget that you can share with us?
Yeah. I think number one, acupuncture is not only safe, but so amazing during pregnancy and during that postpartum recovery too. So I wish more people like knew that they could get acupuncture at any time,
Mhm.
um, even after, giving birth. And obviously I think it's, sometimes hard to like get out of the house initially, um, but I have done, home visits before too. And so, yeah, I think that that's like my main takeaway is that if you haven't tried it, if you're curious about it, but you haven't even thought of doing it for pregnancy or during pregnancy, um, that's like, it's so great. It's such a great just therapy and just general like health maintenance tool. And we treat a ton of different things with acupuncture. But I think, one of my favorite just overall like things to get acupuncture for is just like I need to de-stress and chill out for a little bit and reset my nervous system, and just get like a health tune up. So I think it's not only great to treat all these different conditions, but even if you just need a little bit of a reset, it's just an awesome little tool.
Great. Great. Okay. Is there anything special that you want to promote to the audience at all?
Yeah, I with Destiny Olson, I'm going to be doing a little pregnancy postpartum kind of retreat coming up here in the next couple months. So just something to stay tuned for. And we have a few other postpartum events, not hosted by myself, but at Flow Acupuncture. So try and provide just different resources and events for the community because it's a space that I think, we're always in need of, things, people feeling like they're not just in a so,
Yeah.
yeah.
Awesome. Well, that's exciting. Can't wait to hear what this is all about.
Yeah.
Two great people doing great things.
Yeah.
Okay.
TBD.
Yeah. This is my last question and it's my favorite question. What is the main thing that you want to be known for?
Oh man. I would probably say um that I want to be known for helping turn breech babies. And I don't know why that's become my little thing, but I've been quite successful so far, and I just want to keep that train rolling. And yeah, another great thing acupuncture is, really helpful for. So,
So cool.
yeah.
Awesome. Well, where can we find you? Website, social media, anything like that, where we can find you?
Yeah, we're on all those things. So flowacupuncture.org is our website, and we're also on Facebook. Our Instagram handle is Flow Acupuncture SLC. And we post regularly about our events and things like that as well. So you can always book through our website too.
Amazing. Amazing. Well, thank you so much, Mallory, for your time today and chatting up. It was so good to connect back with you again, and I hope to see you soon.
Yeah, likewise, good to chat.